Aloha, my name is Billy F. Schultze. I'm a student with the Institute of Clinical Acupuncture and Oriental Medicine here in Honolulu, Hawaii. I'm doing a presentation for Introduction to Acupuncture, Xi-Cleft Points, Taking the Plunge. The objective of my presentation is to demonstrate an understanding of Xi-Cleft Points using comparative research and analysis. Here are my references, with my main reference being The Foundations of Chinese Medicine, a comprehensive text for acupuncturists and herbalists. The overview of the presentation, introductions, functions, point locations, clinical applications, and conclusions. Introduction. Xi-Cleft points were first discussed in the systematic classic of acupuncture and moxibustion. The term Xi implies a cleft, crevice, hole, or opening, and the Xi-Cleft points is where the qi and blood, which flow relatively superficially along the channels from the Jingwell points, gather and plunge more deeply. Hence the title of the presentation, Taking the Plunge. The functions of Xi-Cleft points. Well, Xi-Cleft points generally treat acute conditions. Jizing, an example would be cough, uncontrollable cough. They also treat pain, tongku. An example of that would be epigastric pain. And they also treat, in yin channels, they treat disorders of the blood, zuyi, wen luan, and that would be something like nosebleeds. Now they do treat a lot of acute conditions, a lot of pain conditions, and a lot of disorders of the blood, and we'll go into that when we talk about the clinical applications of Xi-Cleft points. And here's the point location for Xi-Clefts of the 12 channels. They don't have their own meridians or channels, so they share them with the 12 primary channels, which is, for example, if you look there, there's lung, and the Xi-Cleft point for that is actually lung 6, so Kongzui. Another example here you see is the bladder, and the Xi-Cleft point shared with that is bladder 63, Jinmen. They also share 4 points with extraordinary vessels. Point locations. Okay, here's the point locations for the arms and hands and fingers, and you'll notice that they do run along all the channels there of the arms. And then here's the Xi-Cleft points of the legs. There are no Xi-Cleft points on the actual body. They're just located on the appendages, and you'll actually see there's one actually located on the center of the foot there. Again, they're used to mainly treat acute, so I imagine if you had a point on the bottom of your foot, that was probably something that you're acutely suffering from. Here's the clinical applications, and again, there's a number of things they treat, but let me go ahead and highlight why they treat acute disorders. So we'll see for Kongzu, which is lung 6. In modern clinical practice, the principal use of this point is in the treatment of acute cough, wheezing, or asthma of any pattern. And then for Liangqi, which is stomach 34, the modern is acute epigastric pain, like we saw in the beginning with the female there clearly suffering from epigastric pain. And you'll notice here I went and also highlighted in purple the acute conditions it treats. And even in Wen Lu, large intestine 7, in the traditional acute disorders of pain affecting the large intestine channel and can clear heat. And then again, another acute condition, we just went over the acute condition with epigastric pain. And even down to GG, DG, which is spleen 8, and the treatment of dimesophoria, especially in acute irregular menstruation masses in women due to this pathology. A special note, you'll see Yangku, stomach 34, It's unique among the Xi-Cleft points of the 12 channels in being located proximal to the knee or elbow. Here's some more clinical applications of Xi-Cleft points. This one I want to highlight variety of menstrual disorders such as amenorrhea, irregular menstruation, dysmenorrhea, and delayed menstruation. And then in Z-Man, it is actually the primary form for treating acute stasis of blood in the chest and heart, giving rise to pain, and hot reckless bleeding in the middle jowl, manifesting as nosebleeds, which we saw in the beginning with one of the blood disorders that Xi-Cleft Points treat. I'm going to highlight in red here the amount of blood disorders that Xi-Cleft Points treat. You see it there in Yingzi, and again in Kidney 5, Shui Quan, and of course, like we had talked again about Zinmen and even pericardium 4 Zinmen again. And then you see some like Huizong, which is a Sunjiao 7, and it has no relevant indication. So even with Xi-Cleft points, some points just don't have no relevant clinical application. Okay, and then here we're going to go into more, and these are kind of more of the unique ones. So Yang Hui, which is gallbladder 36, actually treats rabies. Now it doesn't treat rabies in dogs, but everybody associates, at least I associate when somebody has rabies, a dog is foaming at the mouth, so I thought I'd put that on there. Concurrently though, Subin, which is kidney 9, also treats foaming of the mouth in foaming of the mouth. And there's my foaming mouth guy there, and he's appropriately dressed for traditional Chinese medicine. So that's my conclusion. Demonstrate understanding of Xi-Cleft points using comparative research and analysis. Mahalo, and thank you.